This strange but well-studied psychological phenomenon shows that our memory of pain does not necessarily match our experience of it, and can actually lead to us choosing more pain over less. Understanding it can help us design things like exercise routines so we're more likely to want to repeat them, and it also raises some interesting questions in medical ethics. In a landmark study, people were asked to put one hand in painfully cold water for 60 seconds. Later, they did a second trial where the other hand went into equally cold water for 60 seconds and then stayed in for 30 seconds longer, while the water was slowly warmed to an uncomfortable but a little less awful temperature. Participants weren't aware of the exact timing. Afterwards, they were given a choice of which trial to repeat, and a significant majority chose the second one, the longer one. It seems bizarre because they're just choosing an extra 30 seconds of discomfort. The thing is, they weren't choosing based on the pain experience itself, they were choosing based on their memory of it. In another study that was conducted back when people weren't routinely sedated during colonoscopies, patients rated their pain during colonoscopies and then later gave an overall retrospective evaluation. Those retrospective evaluations were strongly correlated with the peak intensity and with the pain level in the last few minutes, while longer procedures weren't necessarily judged as more aversive. Our memory of short, well-defined episodes of pain tends to neglect duration and be influenced more by the peak, the worst moment, and the end. This is called the peak end effect, and the tendency to ignore length is called duration neglect. This brings up some interesting questions for medical practice. Patients' memories of painful procedures can shape what they agree to in the future, but memory is imperfect and biased. Should medical practitioners' goal be minimizing the absolute experience of pain or minimizing the memory of it? Because these two things are not necessarily the same.